Hello everybody, and welcome to Skeletal System Notes Part 2. So this part focuses more on the axial and appendicular skeletons, in addition to how bone grows, the structures inside and out of bone, and also a little bit on fractures and how fractures repair themselves. So we first start off with the axial versus appendicular skeletons. So we are learning the major bones, but these 206 bones that we have are broken up into two different groups. One along the axis of the body, which would be the head, the spine, and the ribs. The remainder is appendicular. The appendages means a word coming off to the side. So that makes sense that the appendicular skeleton which has the appendages would be the pelvis, the bones of the arms and the legs. So that kind of makes sense. So it's very simple to remember. The only tough part is thinking about the pelvis itself. So like an axle of a car is where the wheels attach to. So the axle of the car is usually a long tube that spins or is in the middle of whatever is spinning. So just try to remember that axial refers to just the vertebral column or spine and not the pelvis. So that's the only part that's a little bit hard for students to remember. Alright, so I'm going to go through some of the notable bones and structures of the axial and appendicular skeleton. There is a lot of information on the different types of bones, the names of the bones, where they're connected, how they develop, where ligaments and tendons attach. So I'm not going to go through all of that stuff. There's really no need for this class. I'm going to give you some of the more interesting facts and little tidbits that I could pull out of your book and pull out of my brain. So here's all the bones of the cranium. You have 3 bones in each side of your ear, which is interesting. The incus, malleus, and stapes on each side. So the bones help you hear. So when you're listening to my voice right now, those bones are vibrating slightly, transferring those sound vibrations into your cochlea from your eardrum. So you can't see those in this picture. But you can see the cranium and the facial bones, a lot of little different bones. We learned the maxilla, or the maxillary bone, which is the major one of the face. But, you also have other one, major one, the zygomatic bone, which makes up your cheeks. And we learned a number of the different bones that make up the skull portion of itself. But you can see there's lots of little bones that we didn't learn. So, giving you a basic overview of the major bones. The mandible is a major bone. Interestingly, if you look at the bottom of the skull, really there's one relatively small opening for where your spinal cord goes into the brainstem. So that's kind of interesting. Most people don't really think about, where that opening is, how big that opening is. We also have to include the teeth when we talk about the skeletal system also, because they are related, but generally that gets talked about in the digestive system more than the skeletal system. So we'll talk a little bit about what they're made of a little bit later on. Something that is unique about the skull, let me go to the picture real quick, is that we have sinuses, and they are basically openings. They're basically openings in the bones of the face and the frontal bone that are lined with this ciliated epithelium. Interesting. Why would they be there? Well, these are collection of air-filled chambers. They're lined with mucous membranes. Mucus is released into the throat and captures dust, microorganisms that will eventually be swallowed or expelled. So these ciliated epithelial cells actually take that mucus and they help push it in one direction towards your throat. So you can swallow it where it would be digested by your strong stomach acids, or you'll cough it up and expel it out through your mouth. Because all day long, we're just breathing in all sorts of stuff. Dust, bacteria, viruses, dirt, particles in the air from nature, from our houses, other people's skin. So this is stuff that, the body wants to try to take care of, else it would just build up inside of your lungs. So even if you're feeling not sick, you're still going to cough many times throughout the day, and you're coughing up some of that gunk, and it's either coming up through your mouth where you spit it out, or it just goes into your esophagus and you swallow it, where it'll be expelled when you go to the bathroom. Also, the paranasal sinuses moisten the incoming air, primarily so the mucus does not dry out, and does not dry out as it goes down to your trachea and also into your lungs. So overall purpose is to protect the respiratory system. So when you get sick, with usually a viral infection, this is the area where the viruses have evolved to attack you, and you'll have a lot of mucus discharge in these areas because the body's white blood cells are fighting the virus attack. And these will drain down through your nose, and also some of them will drain down to your throat. You get all that nasty phlegm, and you're trying to get it out of your body. So that inflammation is caused by those viruses. Or if you have allergies, you're going to be breathing in a material that's going to be causing your immune system to think it's a bacteria or virus and cause inflammation in that sense. You'll still get the, mucus discharge. You'll have chemicals that are released in the air that'll also make your eyes water, which is kind of annoying for anybody with allergies. You know the drill. So that's their purpose, is to protect your respiratory system. It's kind of weird that they go way back. These are filled with air, too. So every time you breathe in and out, you have air that's going in and out of these spaces. So that's kind of interesting. And you can see the little hairs right here. So these will all wave in one direction. They either go this way or this way, depending on the way they're oriented. And they'll literally move back and forth and push any dirt materials trapped. And you can almost see the mucus layer right here also. So depending on how inflamed they are, it'll depend on how much mucus these cells will make. Another weird bone is the hyoid bone. This is connected to your larynx. So this has ligaments that connect to your larynx and actually stabilize it. But it's basically a bone that's basically just kind of floating there. And this would make up the area where the Adam's apple would be, which is more prominent in males and females. So that's kind of a weird bone. And then we have the fontanelles, only occurring in very young children, especially children that are just born, or otherwise known as a soft spot. And you can see the major soft spot right here. So the bones of an infant's cranium, as they're being born, and just a few months afterward, they're not fused together. There is a fibrous membrane that's holding these bones together, and they can move. It's not really easy to move them in a sense, but if a baby spends too much time laying down on their back, for example, the back of the head can actually flatten out, where this would be flat and be push up on the pressure and it would distort the skull. So some babies have to wear little helmets, interestingly enough. And you can see a picture of a soft spot right here. So it's when these bones of the cranium have not ossified yet, and it happens in other parts of the body, in the ribs and in the coccyx of the tailbone, and places in the feet, and also in the facial bones. And some of these bones don't actually fully ossify until the age of 25, which is interestingly enough. And some of them, like the coccyx bone, doesn't actually fully fuse together until someone is, in their 40s, 50s, 60s. Anyways, most of the bones are, ossified by 2 years of age. Otherwise. But the fontanelles, depending on where those soft spots are, they can take 2 to 24 months to close up. So the major one, which you see here in the picture, this one actually takes 18 to 24 months to fully close up. But in my experience, and other people's experience, after 2 to 3 to 4 months, this area starts to begin to fill in quite a bit, where the fibrous tissue, there's a little bit left there, but it's not as noticeable, distinguishable anymore. So it's really that first couple of months where you really notice this, and it is creepy that there's just a little fibrous connective tissue segregating your baby's brain from the rest of the world. So the purpose of these is to allow the brain to expand very quickly. The last few months inside the womb, the baby's brain grows very fast, and that's actually one of the reasons why human babies are born so young and undeveloped, because our brains are so big, and it's a compromise between when and how people have to walk upright, and also have a pelvis wide enough for females to give birth to babies with brains as big as ours. In contrast, a chimpanzee's baby, the development level that they're born, when they come out, is at the same level as a human 2-year-old. So our babies are extremely underdeveloped in that sense. but all the parts and everything is pretty much there and working. So the brain's got to expand very quickly, and this continues after birth, obviously, but it's really, right before they're born. And this also aids in travel down the birth canal, especially for a woman's first baby. This is my my Abigail when she was born in 2010. You can see she has kind of a cone head. She had a little bit of trouble getting out, and they literally had to take a suction cup, literally a large suction cup, about, 2 or 3 inches across, suck it on the top of her head because she got stuck, and they had to pull her out. And this is what her head looked like afterward. And it went back to its normal shape very quickly because she spent some time on her back. It was only like that for, I think, only about a day, and it's probably not even that. So they do flex and move. Interesting. All right, some other interesting notables as we move down. The axial skeleton is your spine, and you have 4 different regions of your spine, and you have 4 different curves. You have cervical vertebrae, thoracic, which generally refers to cervical generally refers to the head. Thoracic refers to the the rib or thorax area. Lumbar is the lower back, and then you have the sacrum and coccygeal area, or a sacral curve. So you can see the different vertebrae are named. Right? If you count them up, you can see how many vertebrae we have. However, when you get down to the sacrum, the vertebrae are fused. And the coccyx, they are mostly fused together. Like I said, they fully fuse up when you get older. So there's no cartilaginous joints in these. And this is basically the coccyx is our tailbone. It's a remnant of the tail that our earlier mammalian ancestors share. So you can see the bones get bigger as you go down. The lumbar region takes most of the weight of the body. I mean, the spine is really charged with holding up our weights. There's a number of muscles that will stretch out to the front and back of us that are all anchored themselves to the spine. So you can see if somebody has a big body or is extremely overweight, that it's more likely than that back problems because you just have strain on these ligaments and these tendons and these muscles over many, many years. And a lot of that strain ends up focusing on the lumbar region, so people have a lot of back problems there. And a lot of the back problems have to do with the discs of cartilage. So this is fibrocartilage, so that means that's the tough cartilage. The cartilage that has a lot of collagen fibers. Doesn't flex very much, although it is a little bit flexible. Your spine has to be a little bit flexible in order to take a lot of the stresses that it takes. You can see the spinal cord, and you have these spinal nerves coming out through these little spaces. These bone protrusions are all there for a reason. They're shaped that way for all of the connections between the ligaments, the tendons, and the muscular connections. They're shaped that way to help make those connections to help strengthen the structure of the entire body. So they're not just like that for random purposes. So lots can go wrong with your back. So obviously we have your spinal cord and spinal nerves going through that vertebrae, but if you just get a little taste of the ligaments and the musculature that is in these areas, you can see all the different ligaments that are crisscrossing, and these aren't even all of them. And then you have tendons that are holding all of these muscles to these bones. So it's pretty easy to strain them, and it's pretty easy to hurt them. It's very, very strong, but at the same time, the area is very, very sensitive. Your spinal cord is right here. So if any damage happens, one of these muscles or one of these ligaments, they're going to give off chemicals, inflammatory chemicals. It's going to stimulate your pain receptors. And those pain receptors are going to have a direct access to your brain. Very, very direct access because your spinal cord's right there. So they have a tendency to hurt a lot. And these muscles are interesting. Vertebrae muscles, they spasm much, much easier than most of your skeletal muscles when they become overstressed. And I think this is potentially an evolutionary aspect that allows them to avoid tearing. So they're much less likely to catastrophically tear like other skeletal muscles. Most of them are small in size too, so it's very beneficial in that way. So spasm means they'll basically, stop flexing. And that's when people like, you see somebody bending over and their back all of a sudden goes, ah, they hurt real bad. It's basically because their muscles have stopped flexing and they give off chemicals that will stimulate pain receptors. And basically your body's way of saying, stop doing that. That's kind of interesting. So if anybody's ever had one of those, they feel wonderful. You get more of them as you get older. So as you go down the spine, you can see the bones are fused and they lack any cartilaginous joints in the sacrum, like I said. These holes allow for attachments for ligaments and tendons, which obviously will attach if it's a tendon going to a muscle. So they're not there for no reason. So there are a number of bones connecting your pelvis and your leg muscles attached to these areas. So it's amazing how many attachments all the different tissues have. Makes them pretty strong. And then you have the coccyx bone. You have some different portions of that. So if anybody's ever got hit in this area, very sensitive part of the body. If you were to fall, you just have to hit it just right or wrong. Hit that coccyx bone. It's very painful, and it'll send lots and lots of pain information right up through the spine to the brain. And every time you move your lower half of your body, do any bowel movements, anything like that, you're going to feel it because there's connections between this part of the body and most everything in that area of the body. Okay, moving to the ribs. The thing I wanted to say about this is that you have your clavicle, which is your collarbone. It's not really a true rib. The true ribs are any rib that is attached directly to the sternum. So you can see them right here. All right, so then you have false ribs that are not attached directly to the sternum, but they are attached to this little blue portion. It's cartilage. And it's tough cartilage, but it's also flexible cartilage. Your ribs can actually flex quite a bit. And then you have a couple pairs of floating ribs, which you can kind of barely see them in this picture. They aren't attached in any way to any cartilage to the sternum at all. All right, so you can see that you have 12 pairs of ribs on each side, and everybody has equal pairs. And then you have this weird little bone that comes down from your sternum called the xyloid process. So when people do CPR, they always tell you don't do it too far down because you can actually break that little thing. CPR would go right on the sternum right here. And if you've ever seen anybody doing CPR, it's meant to push down on the heart. You think you're gonna break the ribs, that's always a possibility if you do it too hard. But they flex quite a bit because of that cartilage. So they're supposed to flex because you breathe in and out. And here's a picture of your hand. And you can see the radius and the ulna. Radius always attached to the thumb. Ulna is a smaller bone attached to your pinky. You can see the number of little bones inside of the wrist. So the wrist bones are basically the carpals. Then the longer bones that we normally think of as being your actual hand are the metacarpals. And then you have the phalanges on the ends. All right. And some bones will have 3 sets of phalanges. Some bones will have 2. Like your thumb only has 2 sets. So the metacarpals are right here. So this is basically your hand, and this is basically your wrist. So there's a lot of little bones in there, and they all have these funky names, which, if you're going to be a doctor, you got to memorize them all, but we're not going to do all of them. We're just doing the major groups. And you can see, this is a picture of the ligaments holding all those bones together. So you can see it's pretty easy to strain, hurt, damage, or whatever you want to say, one or more of these ligaments. So there's a lot in there. Amazing that your body can put all this stuff together and repair it. So as we move down, this is a picture of the pelvis. And really the only notable thing I want to say about that is the differences between male and females. So the left side is the males. The opening where the baby would go is much smaller, more obstructed obviously. Female's pelvis is naturally larger. And, the angle of the arch in the front is much more sharper in a male, and a female's pelvis much more U-shaped. So this is largely because of different levels of sex hormones, different amounts and placement of some of the muscles. Males and females obviously walk differently. The different gaits are because of the differences in the way the pelvis is put together. And if you're looking at the pelvis, the baby would go through this area right here. So directly through there. So it actually brushes by the coccyx tailbone. So this area obviously would enlarge a lot, but you can kind of see and imagine that having a head that was too big, you'd not be able to get through that area. And as we move down, whoops, we have the bones of the foot. So you have the phalanges again on the end. Then you have the metatarsals, and then these bones right here make up the tarsals. And you have a lot of them. The two major bones, though, are the calcaneus, which makes up your heel bone, and then you have the talus bone. The talus bone holds up most of your body's weight and distributes it to the other bones. So that bone has to be especially strong. You can see again, you have the ligaments in the right ankle, and you have a number of them holding these bones together. Lots of places for things to go wrong or tear. Okay, so now on to the structure of long bones and a little bit on the microscopic structure of bones. Okay, so we focus on long bone because, short bones and flat bones, they pretty much are just made out of spongy bone. Some of the irregular bones, like your spinal bones, your flat bones of your ribs, they also made on mostly spongy bone, a little bit of conch backbone. But your long bones take a lot of the brunt of the weight, especially on your legs. So their structure is kind of unique. You have the ends of the bone, which are called the epiphysis or epiphyses. And then you have the shaft of the bone, which is the diaphysis. All right, so now these are the ends and this is the shaft of the bone. So on the ends of these bones, you're going to have articular cartilage. So that's the type of cartilage that lines the ends of the bones that we've been talking about. It's pretty tough. Also in the epiphyses, you're going to have the spongy bone. Compact bone is going to be mainly in the shaft of the bone, and then you're going to have medullary cavity, which is an open space where you would find the yellow bone marrow, and the red bone marrow, of course, will be found in the spongy bone. And then you have two layers of the long bone. You have an endosteum, which is a layer of cells that line the inner medullary cavity, and they're involved with bone remodeling, which is something we're going to talk about in just a little bit. So these house cells whose job is to move throughout the bone and actually destroy it and then rebuild it, interestingly enough. And then you have something called the periosteum, which is a layer on the outside of the bone that contains nervous tissue, blood vessels, and also contains spots that anchor ligaments and tendons. All right, so along all of our bones, there'll be these little notches and little spots that you really can't see on pictures like this. You kind of see one right here. But basically, they're areas where ligaments and tendons will attach to, and ultimately they'll attach to periosteum. But once they attach to periosteum, they're really attached to the entire bone because this is one continuous membrane. So again, very, very strong stuff. So that's the basics for a long bone. The inner bone is kind of cool looking. I've shown you pictures of these before. I think I have microscope slides right here. So I've shown you these before. So in the middle, you have what they call a haversian canal. So this is where blood vessels are entering and moving through the bone. And the actual osteocytes are the black. And these little black lines are called canaliculi. And what happens is these are literally canals that move or that are made into the actual bone. The actual bone, the calcium phosphate bone, is the actual white parts here. And what's kind of cool is these osteocytes, their cytoplasm actually projects through these canaliculi, and they reach out to all of these blood vessels, and what they're doing is they're trying to grab those nutrients, the oxygen and glucose and other nutrients they need to survive and live. Now, if you remember, these osteocytes are actually mature osteoblasts that have built bone around them. So they basically build themselves prisons, and some of them can be in there for up to 20 years, which is kind of weird. Think about that. Anyways, let's go back to some of these pictures. So you can see bone is made in circular structures around each of the blood vessels. They're called osteons. So materials can only diffuse out so far. So that's why these structures are in a circular motion. They also work out very well because circles make arches, and arches are very strong. If you look at antique architectural anything from early history, arches were one of the things somebody figured out that could hold a lot of weight, especially if they're building with stone. So this works out in two different ways, for that diffusion and also for strength. So it takes advantage of those two natural processes. So you can see the spongy bone is going to have obviously pores for where red bone marrow is. The bone that's in spongy bone is called trabeculae. All right, It's the same bone, more or less, that's in compact bone. It's just the structure of it allows for little holes. It's also a little bit weaker, but it's still pretty tough. You can see the periosteum on the outside, very thin layer. So you get blood moving through, feeding these cells. So I mean, bone is very much a living tissue. You can see here that we have nerve also moving through these version canals also. So very much living tissue. I kind of like this picture because this kind of shows you the long view of it. You can see the blood vessels moving through. And also these osteons, which is what the circles are called, they have lamellae, which is basically concentric circles, like circles within circles, which is kind of cool. And that's a result of the way the body actually builds bone. And another picture of those osteons, so the circles. You have canaliculae, which connect the cells to the blood vessels. And remember, these are osteocytes. Pretty cool little structures. So what is that bone made out of? Well, bone's a composite material, which means it's a group of more than one material that is stronger together than apart. So your bone is mostly made out of these two things: type 1 collagen protein and a mineral called hydroxyapatite, which is basically made out of calcium and phosphate. Sometimes you'll call it a calcium phosphate salt. In type 1 collagen, there's a couple different kinds of collagen. So this is very simply a repeat over and over and over again of glycine, alanine, and proline. These are all amino acids that make up the essential amino acids that we take into our body. So it's just repeats of this over and over and over and over again. That makes up type 1 collagen. So the reason why we have these two different things is the collagen acts like the structural rebar, so to speak, inside of the bone. So this collagen is flexible because remember, your cartilage is made out of, your ears may have collagen in them. So they flex, they support. This is a cool picture of what the collagen fibers would look like if you took away all of the calcium phosphate salts. So calcium phosphate salts would be where all the black is. And that would be an osteocyte right in there. So it's pretty amazing that these fibers, they're like woven through the bone itself. So this is a picture of the hydroxyapatite. So each molecule, and you can see you have a number of oxygens. Phosphorus is going to be the purple one. Calcium is the white one. So it has a particular structure. And the structure, this material is very tough. So the calcium, the collagen goes right through this calcium phosphate and it makes something similar to the rebar that we use in building concrete bridges. So if you didn't have this rebar there, this bridge would probably collapse over time. So in the same way that we use rebar, our body uses collagen. So it's pretty cool that some of the fundamental laws of nature, humans think like, oh yeah, we kind of we figured out this technique for making something, when nature's already figured it out, just in a different way, but inside of our bodies. Your teeth are a little bit different, but very similar to bone material. They're called fluoroapatite. So they use the same material, calcium and phosphate, but they actually add some fluoride. So when you were younger, you probably got fluoride treatments on your teeth, and that was to help build up the fluoroapatite in your teeth to reduce cavities. So that's kind of interesting. So they're even tougher. Fluoroapatite's even tougher than the hydroxyapatite. Hydroxyapatite will flex a little bit. Fluoroapatite does not flex. So demineralization of these two substances happens with acids. So I've already kind of talked about that osteoclasts will break down bone using acids. Your teeth get cavities in them when acids break down the fluoroapatite. So you can see here we have some pictures of sugars. Glucose, fructose, and sucrose are the major ones. They're all acidic. So when you eat these foods, the acids, if you eat a lot of them, the acids could eat away at the fluoroapatite over time. And that's where you would get a cavity from. So that's why eating sugars is bad for your teeth. Okay, so a little bit on bone formation and vitamin D. So your book gets into a lot about how bone is built and formed, and I'm basically going to skip that part. I don't think it really adds a lot to a person's knowledge that you might use on a regular daily basis. But we will talk a little about bone formation. Ossification is that process of replacing tissue with bone, and that tissue is usually some form of connective tissue or cartilage. So it requires a reliable source of minerals and vitamin D, particularly vitamin D3, which is the form that your body actually needs to use. Vitamin D3, when it's made in the skin or taken into the body as a supplement, travels to the liver where it's chemically altered, released back into the blood where it goes to the kidneys, would eventually be converted to the hormone calcitriol. And this hormone goes to the digestive tract and tells certain cells to help absorb calcium and phosphorus into the blood from the digestive tract. What a loop. Crazy chemical loop. Sun shines on skin, makes vitamin D, goes to the liver, then goes to the kidneys, and goes to the digestive tract. So, I mean, this is, there's a lot of places for things to go wrong, and it's amazing in the body how many things don't go wrong. But that will allow the proper amount of, or at least a good amount of calcium and phosphorus to enter the blood and be able to be digested and absorbed. Whereas if you didn't have that, you get a number of different diseases. One of them, as we talked about in class, was rickets. And we obviously talk about people's skin color, how that needed to change depending on where people moved in response to the amount of vitamin D they were getting into their body. Other vitamins like vitamin A and vitamin C are required for bone formation. Vitamin C is implicated in osteoblast activity. So when you don't have enough vitamin C, you get scurvy, which results, one of the things it results in is brittle bones, because this vitamin C helps tell the osteoblast to keep building bones. So bone remodeling just basically means that over time, just like a house, your bone gets rebuilt, fixed up. So about 20% of your bones are replaced every year in the typical adult body. This doesn't all happen in the same spot. It generally happens more in the highly stressed bones. They have a higher turnover. Like the head of the femur may be replaced 2 or 3 times a year. And the reason for this is it gives bones to be a chance to be their optimum strength in places where it is needed. And basically what I mean by where it is needed is where it's most stressed. So if there's little small cracks that build up over time, you can have, a damaged bone. So this basically keeps your bones from breaking over time, more or less. It just rebuilds them. That's pretty amazing. And you get other parts of the body where the cells, are hanging out for 20 years where there's low stress. That's pretty amazing too. So the basic bone remodeling, so you got some bone hanging out here. Osteoclasts come in and they'll use their acids to dissolve the bone. Then osteoblasts will build the bone back up and basically back to where it was before. And it's a constant process that is happening 24 hours a day, every day for most of your life. So ultimately, bone remodeling is trying to prevent bone fractures, but we're pretty tough on our bones, and plus as we get older, we can have just naturally occurring bone fractures. These fractures are called reduction, or at least the treatment of these bone fractures. The process of realigning the bones, and you're basically reducing the number of bones. If you have a broken bone, you have at least 2 bones where there should be 1. So when you put them back together to heal it, you're reducing the bones back to 1, going from 2 to 1. So that's where they get that from. So we got closed and open reduction. Closed reduction is where the skin is still closed up, so you can manually set it and brace it with a cast. Open reduction is where you have to surgically go into the bone and put it together with wires and pins. And prior to days of surgery, if you needed to have open reduction, it wasn't happening, so your bones would heal in very unorthodox ways. So you would be walking with the limp, you may not be able to walk at all. It would heal, it just wouldn't heal the way that it's usable again. So a significant injury back in the day before surgery, you would permanently, your body was permanently altered, and you may not be able to do the same things you were able to do before. So once set, generally takes about, it all depends on age and where it is, but anywhere 6 to 8 weeks, 4 to 8 weeks, for those fractures to become usable again. So a simple fracture, this is where you have a basic break. Common unit fractures where it breaks or splinters into many different pieces or shards or bones, so obviously more serious. The press fracture often happens in skulls where there's a depression in the bone. Compression fracture happens a lot in the vertebrae or in the ball and socket portion of the hip bone. And these generally happen from bad falls or from old age, which I'll talk about later on. Green stick fracture happens in little kids where their bones are still very bendy and, I don't know, young, flexible, whatever you want to think of, where it doesn't break all the way. And it's named after if you take a stick off a tree and that stick is still alive, it won't break all the way. Spiral fracture sounds just as bad as it looks, as where a bone is twisted by side torsion forces. Think about that one for a little bit. This one's kind of gross. This is a compound fracture, where the bone actually protrudes outside the skin. Yeah. Here are some ways that, that we have to fix these bones that are extremely damaged. Very well damaged, so we have screws and plates that will have to be surgically implanted into somebody. So how the bone heals. So I kind of typed all this out because there's a lot going on. I didn't want to just show you the picture, because it really doesn't explain enough. If you look at the picture here, and when a bone breaks, a lot of the blood vessels are broken also. And obviously blood's going to be leaking out. And then the blood is going to clot itself. Those platelets are going to clot the blood. So this is called a hematoma. So first you have this large blood clot, you got broken blood vessels, you got blood everywhere in here. It's very painful. So the blood clots. What happens, any remaining osteocyte cells die because they're not getting their nutrients. You just have all this dead tissue. So the first things that have to happen is new blood vessels have to grow to the area. And then when new blood vessels grow to the area, white blood cells will also move into the area and they'll start to digest those dead tissues. So all of this dead material starts to get digested by white blood cells. New blood vessels move into the area, and the process of healing begins. And the process of healing also forms these structures called the callus, which is basically you have an internal and external callus. And these materials, basically we're on number 3 right now, are made by cells of the periosteum and endosteum who migrate to the area. And basically, this callus tissue is made out of hyaline cartilage. So cartilage is easier and faster for the body to make. So it fills the whole damaged area with hyaline cartilage. So it stabilizes the brick. It's obviously not well enough to stand on it or use it, put any weight on it. So in this picture here, you basically have cartilage filling this space, along with new blood vessels. You obviously have a lot of cellular activity also. So what will happen next is osteoblasts will migrate to the area and they'll start actually building up bone, but they'll actually build up spongy bone. Even if it wasn't a place where there was compact bone, they first will build up spongy bones. They call it the bony callus after that. And they'll make the bone, create the bone around these blood vessel eversion canals, which is what they'll eventually be made into. And these canals will stay as spongy bone for up to a year as the body goes through its normal remodeling process, and will eventually turn that bone exactly to where it was beforehand. When it's in the state of being spongy bone, though, it can actually, it can actually be used as normal, because this spongy bone is tough, it's strong, it can hold a lot of weight. There is a slight chance that you could break it again if you did the exact same thing that broke it beforehand. It should be otherwise normal. You'll have that bony callus you can see in this picture right here, which is basically like a bulge in the bone for up to a year until the bone actually goes through the process of being remodeled again the normal way. So all these fractures have to go through that process. So it's amazing. It takes up to a year. And if you're older, 70 or 80, this process may take years and it may never continue all the way through to complete bone remodeling. So everything doesn't work as well as you get older, unfortunately. And speaking of getting older, there's really 3 major problems: osteopenia, osteoporosis, and arthritis. So osteopenia is the normal thinning of bones due to the natural processes of aging. So bones start to thin when you get in their 30s and 40s, and then it accelerates from there on. Women are much more likely to have this happen to them, mainly because of osteoporosis caused by decreased levels of sex hormones. So when a woman goes through menopause, her sex hormone level goes down, and she's at more likely or greater chance to develop osteoporosis. Men can also get it, but men have high sex hormones throughout most of their lives. And obviously it goes down over time, but stays high for a while. And it will cause potentially that to happen in men also. So osteopenia and osteoporosis. Osteopenia and osteoporosis is basically just a matter of degree. Osteopenia, the bones are still usable, they're relatively strong. Osteoporosis, the bones thin so much that they can become likely to fracture. Not much you can do about this. This is looking at the femur bone. Hormone replacement and exercise and diet can slow it down, but you can't stop it. There's some more pictures showing you a difference. Normal spongy bone, osteopenia thins out, osteoporosis literally have holes. This is where, osteoclast activity outweighs osteoblast activity. Alright, so the third thing is arthritis. You got 3 different types. You have disease of wear and tear from advanced age, usually over 60. There's both environmental and genetic factors. There's some genetic factors where people don't replace collagen as quickly as others, so their cartilage is more likely to wear out. If you sit on your butt and don't exercise for many decades, you're not going to have as thick a cartilage as you could, so it's not really a wear and tear there. You could also, what I mean by wear and tear is just by using them over time. But people who exercise too much can get osteoarthritis also. Where they wear the cartilage out more than the body can fix it. So you have environmental, meaning like weight and how much you exercise, what you eat, and they also have genetic factors. They have rheumatoid arthritis, which is totally genetic. It's an autoimmune disease of the joint tissues where the white blood cells actually attack the cartilage. So autoimmune diseases are awful. So your body just doesn't realize that certain tissues are yours, and they attack it and kill it. Gouty arthritis is mostly due to poor health choices. This is caused by too much uric acid in the blood, which when they get to the joints, it can actually crystallize in the synovial, inside the synovial joints, and those little crystals will act like little razor blades and actually cut up your cartilage every time you move them. It's kind of like, maybe not razor blades, it's more like having sand inside of your joints, and they'll shred apart your cartilage, and that's where you'll get a lot of inflammation and pain from that. It's mostly due to food choices and being overweight. So it's usually associated with people with poor health. So here's some pictures of rheumatoid arthritis. So you have huge inflammation around the joints, as opposed to a normal joint. Shouldn't have that. Osteoarthritis, you'll see that the bones are actually rubbing together. So there's someone with osteoarthritis. You can see their joints are inflamed and red. And this would be somebody with very advanced rheumatoid arthritis. It actually disfigures the joints over time. Doesn't feel good. Here's a picture of osteoarthritis of the knee. You can basically see the cartilage is wearing away, and then you see the bone is rubbing together, and you can see that bone is very much a living tissue, so you can see why it's so painful. So what they do for this is, if they can't fix it in other ways, they'll do knee replacements. So they basically cut off the ends of the cartilage of your knee and replace them with plastic and metal. Alright, and the same can happen in all of your joints of the body, but the big ones are the knees and the hips. So this is where the head of the femur can become damaged and rub up against the pelvis bone. The femoral head can be damaged, so this one is damaged over here, this one is not. This can happen due to arthritis too, where the bone can actually be crushed in, or it could happen with osteoporosis or osteoarthritis. They could be damaged or the bone could be crushed in, so you do a replacement. You put basically a metal and plastic ball, put some bolts and screws, and that's what a hip replacement is called. They literally cut off the end of that bone. Alright, thank you very much for listening. Enjoy.